Hello, ladies and gentlemen. I'm Daniel Montano. I'm the Chief Executive Officer of Angiogenesis Medicine. We'd like to invite the people from the FreedomFest family. We've been participants in last year's event, but we're going to be talking now about the topic of can therapeutic angiogenesis extend your life for an additional 30 quality years? I believe we have a major medical breakthrough. So I'm going to ask you a question. And the question is, what was the life expectancy of an American man and woman in the year 1918? So roughly 100 years ago, what was the life expectancy of a man? Think about it for a second, come up with your answer. The life expectancy of a man in 1918 was 37 years, a woman 42 years. If today's life expectancy was 37 years, there'd be a lot of us that would not be on this webinar tonight. The reason life expectancy 100 years ago was so low was a combination of bacterial diseases and the Spanish flu. Now, half of the people died in 1918 of bacterial infections. In 1900, the leading causes of death were from bacterial infections: smallpox, cholera, diphtheria, pneumonia, typhoid fever, the plague, tuberculosis, typhus, syphilis were rampant. They were caused by bacteria. With the discovery of antimicrobials, starting with penicillin, the battle finally turned in favor of human survival. Tuberculosis is no longer the #1 cause of death in the world and the United States. It's heart disease. Things that used to kill us no longer are the major threats. So life expectancy has gone from 37 for a man to roughly 67. And I believe our discovery of therapeutic angiogenesis will take that out another 30, 40 years of quality life. How? Answer. Very simple. First, by utilizing our therapeutic angiogenesis drug to reduce the deaths from heart disease, strokes, diabetes, and neurological diseases and more. So let me make this point. Heart disease kills around 30% of people. 28, some cases 32 in others, but let's call it 30%. Of that, it is not the large vessel disease that kills people. More women die of heart disease than men because women have what they call small vessel disease. It's in the capillaries, it's in the arterioles. They're so small you cannot bypass them. They're so small you can't put a 1 millimeter catheter down a 5 nanometer vessel. The only way to grow new blood vessels in that heart in that condition is naturally through angiogenesis, what we do. 12% of people die from strokes. And we believe that we can change the outcome from strokes dramatically. And Dr. Jacobs, my partner, is going to give you all the medical evidence. I'm here just to put the framework in place. Diabetes, neurology diseases. We believe Alzheimer's, Parkinson's, vascular dementia, all these are vascular functions that we can change with therapeutic angiogenesis. So #1, instead of you dying when you're 75, if we defer that because we revascularize your heart to 105, that's one way to extend your life. #2 is, second, utilizing our therapeutic angiogenesis drug, we believe we can enhance the perfusion in the brain, in the heart, the muscles, so that you have a less dramatic decline of age. One of the things that Jack is going to approach is when a person gets older, their brain starts to shrink. It shrinks because we believe the vascularization is eroding away. We believe, and so does Columbia School of Medicine in New York, that if we can reestablish that vascularization in the brain, we're going to have better brains, more memory, greater cognitivity. And in my case, I think sure it's going to help me last 130 years and remember it. The question is, can therapeutic angiogenesis extend your life an additional 30 quality years? My partner, Dr. Jack Jacobs, is going to give the presentation. Let me introduce Dr. Jack Jacobs to you. Jack has his PhD from Washington University, St. Louis. He was then at Hitachi Pharmaceuticals, and then he was at Merck for about 10 or 15 years. Jack's been with me 20 years advancing this therapeutic angiogenesis through the clinical trials, the FDA, and all the processes we have to go through. Jack is one of the nicest people you'll ever meet, and he's one of the smartest people I've ever known. And with that, I turn it over to my partner, Dr. Jack Jacobs. Jack?
Thank you, Dan. That was a nice introduction, as always. So I'll be talking about this concept of therapeutic angiogenesis, how we're going to treat diseases that kill lots of people, reverse those diseases, and then also how we can improve the quality of our lives as we age by making sure our vasculature stays in good shape. Just to remind you all, you have almost 60,000 miles of blood vessels in your bodies, enough to wrap around the earth almost 3 times. And we know if you get blockages in arteries in the heart, you can develop heart disease, in the legs, peripheral artery disease. And more recently, as Dan alluded to, it's been shown that neurodegenerative diseases such as Parkinson's disease, Alzheimer's disease, all are initiated and progress by this blocking off of the blood vessels, choking off of the neurons. So we'll talk about that as well. In fact, over 75 human diseases are caused by lack of blood perfusion, impaired perfusion. I'm not going to talk about all 75. We're actually developing drugs for 19 of these 75 indications. I'll give 3 examples today of what we're doing. What's the easiest and most direct way to increase blood perfusion, let's say in the heart or other tissues? Grow new blood vessels. Put more pipes in, get more blood perfusion into that tissue. And that is exactly what our drug, which I'll talk about in a moment, does. It stimulates the growth of new blood vessels in tissues that need a boost of their blood supply. The process of growing new blood vessels is referred to as angiogenesis. We use it all the time. It's not an abnormal process. Let's look at normal angiogenesis. This is a skateboarder, fell off his skateboard, scraped his elbow there. And angiogenesis is going to be used to regenerate his damaged tissues. So let's look at this a little bit closer. Let's imagine this is the scab on that skateboarder's arm, elbow. We're going to look underneath that scab, and here we see angiogenesis at work. These are all brand new blood vessels stimulated by the drug I'm going to be talking about that we're developing. But these blood vessels are going to heal that skateboarder's wound. And not just recreate skin, it's going to recreate hair follicles, nerves, sweat glands, whatever you need to regenerate skin as an organ. And the product in our bodies that's stimulating this very important process is the growth factor that we are developing as a drug. So I'll show you that next. It's called FGF1. It's found in highest concentrations in our brain. Actually, as a graduate student many years ago, I was helping to purify this at Washington University, slopping cow brains home from the slaughterhouse, and we would purify FGF1 from that source. We don't obviously use that now for our clinical trials, but FGF1 is probably the most potent stimulator of angiogenesis in our bodies. Let's look at this process of angiogenesis and how it works. When that skateboarder cut himself, immediately his body began synthesizing and releasing FGF1, as shown here. And this growth factor basically swimming to the damaged area, importantly, binding to these FGF1 receptors shown in yellow. Okay, so this is the critical event. This is kind of a key going into a lock, stimulating new blood vessel formation. Interesting, in damaged tissues, these receptors are highly upregulated, 100 to 1,000 fold. So we really only see this FGF system working in damaged tissues. So once you get binding, you get a kind of an explosion inside the endothelial cells, which are cells that line all of our blood vessels. They start dividing and they start migrating. and they start breaking down the blood vessel so they can put out a new projectile, a new tube here. Here's a tube made of endothelial cells stimulated by our drug. This is the very beginning of a new blood vessel. And as you can see here, those tubes elongate into capillaries, into small arterioles, and this is what we saw underneath that scab when we looked at that picture of angiogenesis. Okay, we are developing angiogenesis, as I mentioned, for 19 indications. I'm going to present 3 today. We're going to start at the bottom of the body, look at healing of diabetic foot ulcers. That's a topical application of our drug. There's FDA clinical trial data that I'll show you. We'll then move up into the heart, coronary artery disease, where we're injecting the FGF1 directly into the ischemic or damaged heart. Then I'll end up with neurodegenerative diseases. We know that lack of blood flow initiates Parkinson's disease, so we're going to give that as an example. And then we'll talk a little bit about how angiogenesis can be used to help us age more gracefully. Okay, the first indication, diabetic foot ulcers. 25 million diabetics in the United States. Every year, 5 to 7% of those diabetics will develop this nasty foot ulcer, as shown here. These are chronic wounds. They don't heal. They can get infected. Once infected, can lead to gangrene, and probably the most dreaded complication of a diabetic foot ulcer is a lower leg amputation. When that happens, the normal life expectancy of a person is 2 years or less. So let me show you some data where we put FGF1 directly into the wound, cover it with a bandage. And in a clinical trial, we looked at wound healing over a 5-month period. Just wanted to show you this before the data, that diabetics have a much lower blood flow in their feet. Here's normal capillary blood flow. Here's a diabetic foot blood flow, about 67% reduction in blood flow in a diabetic foot. Okay, so let's move to that clinical trial. This is a phase 2 FDA authorized clinical trial where we treated ulcers, chronic ulcers, diabetic foot ulcers over a 5-month period. And this is a fraction of the ulcers that remain open. So 100% obviously are open at the beginning of the trial. We treat one group in blue here with FGF1. The other group in red is placebo. And you can see as we go through the clinical trial, the days, weeks, and months, we start closing all of those ulcers that were treated with FGF1. So down here around day 130, 100% of the ulcers treated were closed. So that's a very remarkable and satisfying clinical trial outcome. About 35% of the placebo-treated ulcers remained open. And that's a big deal, between 35% and 0%. These patients, again, are at risk to develop infections, lower leg infections, lower leg amputations, great misery, great economic cost, and really the quality of life for these people is much reduced. So by closing those ulcers, we are improving the quality of life and extending these people's life significantly. So we'll be looking, here's just a picture of an ulcer before we treat it with FGF1, and this is after about 4 months of treatment. So we'll be moving ahead with this, doing some phase 2 clinical trials. Applications will be submitted to the US FDA and also to Mexico, where we've had a lot of success in getting trials approved. Phase 2 trial will be similar to the one that I just showed you, dosing 3 times a week for 5 months or until the ulcers healed. And we've identified principal investigators and sites that have a large throughput of ulcer patients to carry out these trials, where we'll be carrying out these trials. We also have a nice new digital camera that's been developed that can quantitate how big the ulcers are. That's the main readout, the main clinical endpoint. And this thing does a really nice job in photographing the ulcer and actually calculating the volume of the ulcer. So we'll have very sensitive and accurate ways how to measure the healing rates of those ulcers. We also have data on other wound healing indications. There's phase 2 data on healing venous leg ulcers. These are very large, very painful ulcers that people get. And we also plan to pursue clinical studies, burns, military wounds, bed sores, a very large indication, surgical incisions. Very interestingly, in animals that are given a surgical incision, if you put FGF on those wounds, they close with much less scar tissue. So this could have a really big application in terms of cosmetic surgeries. Okay, let's go to the next indication. Obviously, this is not a topical delivery of FGF1, but we're going to inject FGF1 directly into the heart of these patients. These are patients with severe coronary artery disease, where their heart muscle is basically starving from lack of blood flow. As Dan mentioned, heart disease is the leading cause of death in the United States, both among men and women, and it's actually the leading cause of death in the world. Now, this is what happens normally in people who are healthy, let's say a healthy 65-year-old. We all get plaques in our coronary arteries. We start getting them as young as 25, and let's say here's a blocked off artery. So healthy people can develop what's called collateral circulation. Other blood vessels are stimulated, probably by FGF1, but are stimulated to take over the blood supply of this affected area. So these patients would not have symptoms. They wouldn't have angina or chest pain, and they really don't need to be treated. However, other patients, for whatever reasons, can't develop this collateral circulation. And a blocked blood vessel leads to what's called ischemia. So the heart muscle starts getting starved for nutrients, for oxygen, and it starts getting weaker and dysfunctional. This leads to chest pain on exertion, and eventually it will lead to a heart attack. So let's look at some clinical trial data where we injected FGF1 into the hearts of patients suffering from this severe coronary artery disease. 3 trials were done, 2 in Germany, mainly focused on the one in the United States. This was an FDA authorized clinical trial. I know the results very well. I supervised this trial and was very pleased with the outcomes. Here are our patients that were enrolled in the trial. They were basically no option heart patients. They couldn't have a bypass. They couldn't have a stent put in. The men often presented with these large vessel blockages as shown here. This is about a 70% blockage in the main artery. And they also had other blockages in their smaller coronary arteries. So we would treat them in both places. Women more likely have small vessel disease. Dan referred to that. This is blockages of the small coronary arteries. In the heart, you can see here, blockages here. This main vessel is pretty much open, blockages here. Again, small vessel disease. There's no way you can bypass this type of vessel, no way to put a stent in there. So our treatment really is the only treatment for this type of disease. Let me show you some results from that clinical trial. Probably the most dramatic improvement we saw was in chest pain. And this is called angina. So everyone who entered the trial either had very severe angina, that's class 4 in red here. And these are people who have angina pretty much all the time. Yellow is class 3. This is moderately severe, so climbing a flight of steps would give these people very significant chest pain. We treated all these patients, looked at them 3 months later, and look at the vast improvement in their angina scores. Basically, almost eliminated class 4 and class 3 angina, and they were all converted to class 2 or class 1. Class 1 is really only chest pain on very high exertion, such as being running hard on a treadmill. So 90% of the patients improved by at least 1 class, 60% improved by 2 classes. So a very significant result. We also put these people on a treadmill to see at their exercise performance. And again, post-treatment 3 months out, they had significant improvement in how well they did on the treadmill test. Now, let me just show you one of our sites, our highest enrolling site, the University of Cincinnati. ABC News actually went there to do a story on the cardiologist, Dr. Lynn Wagner, who was treating these patients, and interviewed some of the patients, I'm going to show you this short news clip. I'm not going to talk through it, but I want you really to pay attention when Dr. Wagner points to the angiograms and actually points at the new blood vessels that were grown in these patients' hearts 3 months after we treated them.
But since receiving an experimental treatment for his blocked arteries, his pain is gone.
I really feel great.
Duke was one of the first heart patients in the country to be treated with a protein actually capable of growing brand new arteries. The genetically engineered protein is injected directly into the heart. Within days, a network of new vessels begins to grow around the blockage, increasing the blood supply. Dr. Lynn Wagner showed us the changes in one patient's heart.
We see a small, narrow main artery and not very many secondary and tertiary arteries. This is after the treatment. What we're now seeing is new blood vessels growing here off the end of this artery.
And the patients themselves?
Symptomatically, they're improved within a couple of weeks of the treatment.
Just ask Constance Donnelly.
Oh, I feel wonderful. I've never felt so good in the last 5 years.
But doctors already see potential in other cases where the blood supply needs a boost, such as strokes and diabetes.
So that woman we saw there, Constance Donnelly, came in a wheelchair. She was a cardiac cripple, and you can see her 3 months later. She looks much, much better. I got to publish some of that work, which is always good for a scientist. And we're going to continue this program. We're going to be using commercial grade FGF1. That's FGF1 that's been made in an FDA inspected facility. That's important because then you can go on and use that as your commercial material once you get approval. We'll be repeating that study, but rather than injecting it through the surgical incision in the chest, we're going to be using an injection catheter, which is less invasive. We're going to apply for FDA breakthrough therapy, which is a new designation that allows you, in some cases, to get approval after a pivotal phase 2 trial. And so we'll be going for that. That certainly applies. It's for unmet medical needs. These patients have no possible therapy. We'll also use more modern methods to look at cardiac perfusion. We'll use cardiac perfusion MRI as a more accurate readout of the patient's ischemia. Here's a catheter we'll be using. It goes in through the femoral artery, and here it comes right into the inside of the heart. And we inject, here we see FGF1 can be injected right into the heart wall with this catheter. Cardiac perfusion MRI, there's a colorized version, but this is much more accurate than what was used previously to look at new blood flow in the heart after we grow those new blood vessels. So if we can treat these patients, we can stop them, reverse their coronary artery disease, and have them live longer. What about others, healthy people who may want to extend their lives in a more healthy way? Well, we think we can use FGF1 to prevent ischemia and prevent it before people develop angina or a heart attack. New imaging devices such as this one can look at ischemic tissue in the heart before any symptoms arrive. So we can imagine a 65-year-old coming in for a colonoscopy, but also for a scan of their heart. And if they show up any ischemia, we can treat that with FGF1, treat it before they go on to develop angina or a heart attack, thus extending their lives in a healthy way. Okay, I'd like to end up talking about our work in Parkinson's disease. Your brain is probably the most vascularized tissue in your body, billions of capillaries supplying billions of neurons. We're going to talk about treating Parkinson's disease, and we believe the mechanism is through reestablishing blood flow, vascularization, to a very small area of the brain that is affected in Parkinson's. Let me talk a little bit more about the interaction of the blood supply with neurons in the brain. Here we have a large artery giving rise to the capillaries. This is the microvasculature. This is the primary interaction between neurons and the blood supply. Here's an open, healthy capillary supplying this neuron with glucose, oxygen, and also very importantly, removing metabolic waste products that all cells generate. And we'll talk about that. That'll be important when we look at Parkinson's disease. Also not shown here, but there are stem cells. We all have pools of stem cells, 9-year-olds as well as 10-year-olds. And they also need a good blood supply to survive and form new neurons if these neurons become damaged and need to be replaced. Let me just show you an example of growing new blood vessels in the brain with FGF1. This is in some animal data we have in a stroke model. And here's normal capillaries in the rat brain. Not shown here are the millions of neurons which these capillaries are supplying. We give the animal stroke, and look at this, we decimate the vasculature, and we also decimate the neurons. And these animals are not doing well at all. You put them on a standard balance beam and they fall off. We treat one group of those animals with FGF1. We see here 14 days afterwards, reestablishment of blood vessels, of capillaries in the damaged brain. Without FGF1, the brain desperately tries to heal itself, but it can't quite do it. This is disordered growth. This clumping of capillaries actually leads to bleeding, and the animals become even more damaged. So this is what we hope to do in these neurodegenerative diseases: reestablish blood flow, reestablish healthy neurons. Okay, let's look at Parkinson's disease. I'm going to show you in a minute perfusion data, looking at this very tiny area of the brain. It's called the substantia nigra. Here it is here, these two little lobes. Deep in our midbrains, it's where the dopamine producing neurons are found. And these are the neurons that become dysfunctional in Parkinson's disease. So we and others feel a lack of blood flow, a choking off of the blood supply leads to these neurons becoming dysfunctional, secreting less dopamine, and leading to the movement disorders that are so characteristic of Parkinson's, the gait disturbances, the tremors. Let's look at blood perfusion in this area of the brain in healthy people and people affected by Parkinson's. Okay, this is using, again, functional MRI, a newer technique to look at regional blood flow in the brain. We're looking again at that very small area where the dopamine neurons are, the ones that are affected by Parkinson's. Here's a healthy 21-year-old, full maximal blood flow in that region. Healthy 65-year-old, we know as we age, there's less blood flow to the brain. Dan mentioned that, but not to the degree where you would develop the symptoms of Parkinson's disease. But look at Parkinson's disease patients. Almost a 50% reduction in blood flow in that area of the brain where the dopamine cells are. So we believe this lack of blood flow is the primary cause of the initiation and then the progression of Parkinson's disease. Now, people with Parkinson's also have other symptoms that affect other areas of the brain. I'm going to show you some perfusion data on a woman with Parkinson's, but also has developed dementia, which is common in Parkinson's. And dementia, more of the frontal cortex region of the brain is affected. And we can see when we look at a scan of this woman's brain, Parkinson's with dementia, blue is normal blood flow, yellow is reduced, red is greatly reduced blood flow in this patient's brain. And these areas all line up with cognitive function, areas that control cognitive function, executive functioning, memory. So if we treated this patient with FGF1, we would expect hopefully not only to restore neurons, blood flow and neurons to the motor region of her brain, but also to this region of the brain involved in cognition. Okay, we looked at FGF1 in a monkey model of Parkinson's. This is kind of the gold standard before going into people. You can give these guys Parkinson's disease by injecting a toxin directly into their brains, which selectively knocks out, kills the dopamine producing cells. And these monkeys come down with all the classical symptoms, motor symptoms of Parkinson's disease. Let me show you some results from that model. So at day 0, we treat with this toxin, again, which kills over time the dopamine producing cells. And this is motor function. So this is normal motor skills. This is very abnormal motor skills down here. So after we give that toxin, we can see after about 9 months, these monkeys are displaying all the classical symptoms of Parkinson's, gait disturbances, tremors. We treat one group of monkeys with FGF1 in blue. We treat this group with placebo. And you can see over months, these FGF1 treated animals actually halt the progression of their motor skills decline and actually get better. They get back to about 75% of normal motor activity. And perhaps if we treated even longer, they would have improved even more. This is when the experiment was stopped. Placebo-treated monkeys did very poorly, very abnormal movement. The difference between this and this is very significant. Now, with these animals, we can look directly in their brains and see if we're doing anything to the dopamine producing neurons. We know in Parkinson's, it's the dopamine cells that are being damaged, and we can actually look right in the substantia nigra region of the brains of the animals and see if we're affecting, if we're regenerating dopamine cells. And in fact, we are. This is looking at slices through the monkey's brains through the substantia nigra region. New dopamine neurons stain brown. So you can see in the FGF1 treated animals, this new regeneration of the dopamine neurons, where without treatment, there's very few new dopamine neurons being regenerated. So this is really addressing a root cause of Parkinson's disease in these monkeys. We're reestablishing new neurons, new dopamine neurons. We believe this is directly responsible for the better motor skills that these animals exhibit. Now, I mentioned that neurons also produce waste products that have to be removed. And if these aren't removed, they can accumulate and cause problems, both in people and in these monkeys. And we know, for example, in Alzheimer's disease, the beta amyloid plaque accumulates, is very toxic to brain neurons. The same thing happens in Parkinson's, different proteins, synuclein aggregates. This happens in these monkeys, but also the same thing is seen in the human disease. With FGF1 treatment, we're flushing away, not all of this, not quite back to normal, but getting rid of a significant amount of this very toxic protein. This is killing the dopamine neurons as well. So we think these two very important activities addressing the root cause of Parkinson's. One, regrowing the dopamine cells, neurons, and two, getting rid of these toxic tangles leads to the improvement in these monkeys. So we're very excited about this, very excited to take this into the clinic. We've submitted an application to the US FDA. They liked it, but they wanted us to do one additional animal study before going to humans. Mexico submitted the same trial. They loved it. They said, get going. So we've been approved to treat Parkinson's patients in this first trial, first human trial with the FGF1. We'll be looking at 3 different doses of the drug. No placebo groups. All patients will get a 1-hour IV infusion of FGF1 5 days a week through a central PICC line, which allows us not to stick the patients so many times. We know FGF1 can cross the blood-brain barrier, so the IV infusion should be effective. And this is what we call a proof of concept trial. First time in people, looking at safety and hopefully some effectiveness. But as long as it's safe, we can tweak this trial. We can give more FGF1, higher dosing. We can give it for longer. So we can kind of tweak this trial until we see good efficacy. Now, as I mentioned, we're developing drugs for 19 medical indications. These are all, in many cases, very serious indications. I've written white papers on all these. You can go to our zgm.care website and request white papers that go into more detail about any of these circulatory disorders. Talked about heart disease today, stroke recovery, PAD in the legs, wound healing disorders. We talked about diabetic foot ulcers, but we also have data on all these other wound healing indications, including male pattern baldness. We found kind of almost by chance, if you inject FGF1 sub-Q in animals, you get tufts of hair, new hair forming. So this could be a possible new indication. And again, as I mentioned, we and others believe all of these brain disorders are caused by, are initiated by a lack of blood flow in the brain. including what I talked about today, Parkinson's, ALS. We've been given approval to start a human trial in Mexico in ALS patients, and we'll be submitting applications in both the US and in Mexico for Alzheimer's, chronic depression, MS, traumatic brain injury, PTSD, CTE is what the boxers and football players suffer from repeated head injuries, vascular dementia. MSA is a very fast progressing form of Parkinson's. Okay, Dan alluded to the study from the prestigious Columbia University Medical School on why our brains perform worse as we age. So here's one way we can improve our brain health as we age. This is not looking at diseases now. This is just looking at healthy brain aging. This study from Columbia University was published in a very prestigious journal, Cell, and Time Life did a short video on this, which I'd like to show you. But just let me give you the punchline of what they found, okay? We all have these neural stem cells in our brains, whether we're 90 years old, whether we're 14, and they'll show this in the video. But we need adequate blood flow, perfusion, to keep those neural stem cells active. So what the Columbia researchers found is that a lack of blood flow as we get older causes these stem cells to be less active, and they were less able to differentiate into neurons and also these other supporting cells. So as we age in our hippocampus, which is involved in memory, we make less new neurons, they're less active, and we become more forgetful, where our car keys are, where names of people. So let me now show you that video. I'm not going to talk through it, but it really does support what we believe about blood perfusion in the brain. So we agree completely with that video. We believe that in healthy aging, if we could increase blood flow to the brain, we could extend people's healthy brains longer, give them higher quality life for a longer period of time, give Dan Montano out to 130, not forgetting where he put his car keys. So not only in disease, reversing these diseases, but helping people live longer lives, healthier lives, we believe is possible through this process of angiogenesis. So we'll take any questions now, science and medical questions to me. Dan will take any business or investment questions. And I just want to show you, this is our last slide. This lists our website, zgm.care, where you can go to ask white papers, to sign up for clinical trials. And you can also email directly. There's his email there right on the screen. So thank you for your attention.
Jack, excellent presentation. I can hear the rounds of applause coming from our audience, even though there's no sound from that side. We've got a few questions here, Jack, that I think the audience will appreciate. Let me start off with a medical question from one of the viewers. Can this FGF1 growth factor promote cancer tumor growth?
That's a very good question, and we take that very seriously, and so does our FDA. It does not initiate cancer growth. We've looked very carefully at that, both in our toxicity testing in animals at very, very high doses, and also in our clinical trials. We follow tumor markers very carefully. We've never seen initiation of cancer. We do exclude people who have had active cancer from our trials, who have cancer currently, because giving a very potent growth factor to someone with an existing tumor is never a good idea.
Okay, I have another question here. It's from one of the viewers. I have a friend who has Parkinson's disease. How can they learn more about what you're doing?
Go to ZGM Care, request the white paper we've written on Parkinson's. But more importantly, in 2 weeks from now, if you go to our website, you'll see I'll be giving an hour-long presentation on the work with Parkinson's. And you can learn more about where we're at with our clinical trials in the US, Mexico, and Estonia. And you can also sign up if you want to receive literature on our Parkinson's clinical development projects.
I'd like to also comment on that. About every week, Zhicha gives a webinar on one of the medical indications we're working on. Please understand, as Jack mentioned, of the 19 medical indications we're working on, 16 of them we believe are unmet medical needs. That means there is no other therapy to treat these people, like Parkinson's disease, Alzheimer's, small vessel heart disease. So every week we're giving a webinar presentation for your information. We don't have anything to sell. We'd like to recruit some people for the clinical trials, but we're doing this. Today we had a webinar on multiple sclerosis. We had an extremely good audience. We had a lot of questions, and a lot of people are surprised to learn we may have a treatment that could basically effectively cure multiple sclerosis. Next week, Jack's giving a presentation on chronic depression, something that affects 16 million Americans. And the older you get, the greater the likelihood. Now, Jack, I have another question for you. This is from somebody who says, I have a friend who's had multiple sclerosis for 20 years. Could your treatment for multiple sclerosis possibly still be available to them?
Yes, I think we'll probably start our MS trials with people who are not as severely affected, trying to develop new vasculature, cut down on the inflammation. But certainly as we proceed through the trials, we'll be taking in people who are more severely affected. And of course, once the drug gets approved, it will be available to everybody who has MS.
Okay, Jack, I've got another question here. I have had stents in my heart, but the doctor tells me that I'm experiencing restenosis. Could our drug possibly treat his condition?
Our drug would be a great choice to treat his condition. Restenosis is a real problem with stenting. I've read some articles where 40% of people restenose after 5 years after stenting. We can grow new blood vessels in that person's heart around the stenosed, stented vessels, give them more blood flow. And we've looked at our vessels 3 years after we've grown them. They're still there. They're still open. They're not getting blocked again. So we feel, very durable vessels in patients that we've treated.
We have one here. Clinical trials are being held for Parkinson's where, Jack?
They're being held, they'll be starting first in Mexico. We're at the Estonia FDA right now as we speak. As I mentioned, the FDA has asked us to do one additional animal trial. We're doing that now. Hope to start sometime next year in the United States.
Jack, we have another question from somebody. How is FGF1 delivered for neurodegenerative diseases?
Okay, we'll be delivering it intravenously. We know in our animal experiments that we can reverse Parkinson's disease through intravenous delivery. Sometimes with other drugs, you have to directly inject it into the brain, which is very invasive, somewhat dangerous. Infections can occur. So we really like the IV dosing. We're going to have actually a port put into patients. So we wanted to be sticking them every day. We'll deliver the drug through that port and actually take blood out for laboratory testing. So that's the way we'll be delivering it. And hopefully we'll see some nice results.
I believe we'll continue to advance for one simple reason. 10 million Americans are suffering from angina. That's heart disease. Of that 10 million, probably 8 million, we are their only hope to be treated, to lessen their pain and extend their life. In the case of stroke, in the United States every year, there's roughly 1 million stroke victims. Of that 1 million stroke victims, approximately a third have very little adverse events. They recover almost 100%. A third die, and a third have a severe problem. We believe that third, we can bring them back. And you ought to see the presentation Jack did on stroke recovery. And by the way, if you go to YouTube and look up Angiogenesis on YouTube, you'll see about 7 of our presentations that Jack and Vika have done on stroke recovery, on heart disease, on diabetic foot ulcers, and Alzheimer's. I mean, you should go and see that the medicine is cutting edge. But the other thing is that under the FDA, there's a thing called breakthrough designation. And that is if you're dealing with an unmet medical need, which we believe 16 of the 19 we're working on are unmet medical need. If you deal with that and get that blessing from the US government, then you can be approved after phase 2, which can save you a lot of years. Now, the reason I mention this is that I believe out of the 16 shots we have on goal, I can't believe we're going to land some for the simple reason you saw the work on the diabetic foot ulcer. That affects roughly 7 million, or 5 to 7% of the 30 million people that live in the United States and Canada that have diabetes. So between the United States and Canada, there's roughly 30 million diabetics. 5 to 7% will develop a diabetic foot ulcer. If they don't get healed and become infected, it can lead to gangrene, it can lead to amputation, it can lead to death. For those people, we're their only hope. For the people with small vessel heart disease, and that's mostly women, that we're your best hope. I can tell you one thing that President Trump has done is he's definitely accelerated the pace at the FDA. We have an application for COVID-19, not to deal with the disease, but COVID-19 destroys lung tissue. Our molecule can regenerate that lung tissue. Correct, Jack?
Correct.
But the point being is, I believe with a breakthrough designation, now one of the reasons we're in Mexico is that it's going to take us another 1.5 years to comply with what the US FDA wants for Parkinson's. The people of Mexico have accepted our animal data. They've given us permission to proceed. Unfortunately, COVID-19 has shut down their hospitals temporarily. But we know that if we dose people in Mexico and the molecule is safe in their brain and we see their tremors go away, we see their situation reverse, that gives us the willingness to spend whatever it takes to prove the fact we can treat Parkinson's, Alzheimer's, multiple sclerosis. Now we have another question, do we have any competition? The answer is no, we're all alone. We have an effective, biggest marketplace opportunity in the world, and we're the only one dealing with it. Now, I don't have enough time to explain to you why that's the case. I can tell you that when I started on this 22 years ago, at least another 30 companies came along that wanted to do the same thing. But all of them wanted to use gene therapy, which was a new fancy thing that you could get intellectual properties on. I decided to stick with a natural molecule. If it was good enough for God to put in me, it's good enough for me to put in other people. Everybody else disappeared because gene therapy has failed. We're alone. There is no one but us. And under the new law, the first one to market gets a 10-year monopoly in Europe, a 12-year monopoly in the United States. Between you and I, 10 years in a monopoly in the heart condition, the diabetic foot ulcer, life will be wonderful. So that is what we're doing right now. We're all alone. If you have any questions, if you want more information, please either come to our website, zgm.care. If you want to see more, go to the YouTube and look at our presentations there, Angiogenesis. If you have friends that are interested, some of you are asking, why the heck are these guys giving a webinar if they've got nothing for sale? That's because we need friends, people. We need friends. I believe we have the medical breakthrough of the century. I believe we can add 20, 30 years to your life. I ask you one favor. You don't have to believe us. You don't have to trust us. Follow us. Look at the material. Read the material and see if there is any other answer but the answer that we show you. It's the blood flow. We've had doctors come to our presentations, and when they're walking into the meeting room, you could hear them. Oh, I don't believe these guys. Oh, this is all black magic stuff. It's not real. They see the presentation Jack gives, and I ask them afterwards, well, what do you think? And their answer is always the same. Well, it's obvious. It's the first thing you learn in medical school. You've got to get blood to the cells or they suffer. That's all we're talking about. This is not gene therapy. This is not your genome. This is not this and that. It's one simple thing. We've got to get blood to your cells. Subject closed. And that's what all therapeutic angiogenesis is about. Jack, I want to thank you for a brilliant presentation.
Thank you.
Ladies and gentlemen, I hope we'll hear from you. And more important, folks, I hope that God blesses you and you stay healthy and well. Good day.